Good afternoon. My name is Sapphire Garcia-Glancy, and I'm the Kansas ambassador for a public health campaign called Count the Kicks. Today, I'm going to share some information with you that I hope you'll pass on to your patients. The goal of the Count the Kicks campaign is to reduce the rate of stillbirth nationwide. Right now, 1 out of every 150 babies in the U.S. is stillborn. That's a really shocking statistic, but we can help prevent this from happening. By educating expectant parents on the importance of tracking their baby's movements in the third trimester, we can help ensure that mothers and babies get timely interventions before stillbirths occur. Now, before I talk about the specific methods that Count the Kicks teaches, I'd like you to picture a scenario that we're all familiar with. Imagine that you're drowning. You're out in the middle of a lake, and all of a sudden you realize that no one can see you or hear you. So how is anybody ever going to save you if they don't even know you're out there drowning? Well, I want you to think of that panic and consider that this is what happens every time a baby's stillborn. Nobody knows that anything's wrong until it's too late to save the baby. And it happens quite a bit. This is actually more common than you'd think. 1 out of 150 pregnancies in the U.S. end in a stillbirth. This really does affect families. To tell you how this affects families locally, I'd like to share something with you. I want to tell you about a case study. And this was a local mother. She was 26 and she was expecting her second baby. Both of her pregnancies had been normal and healthy, and there was no cause for concern. And then at 38 weeks, she started noticing that her baby wasn't moving normally. She went into her doctor, and her doctor and all of her friends and family told her that less movement was normal, that it was nothing to worry about. They said that babies normally move less towards the end of pregnancy and that the baby was just settling down for labor. And so she went home, and she finished washing baby clothes, cleaning, and doing all the things that moms normally do in the days before their babies are born. And what do you think happened next? Well, I can tell you exactly what happened next, without violating any patient privacy laws, because that mother was me. It was a Saturday morning, and I woke up, and I realized suddenly that after a few days of my baby moving gradually less and less, she wasn't moving at all. And so I started to panic, and I drove straight to labor and delivery. I figured they'd hook me up to a monitor, and they'd say everything's fine. They'd tell me to go home and to wait for labor. Well, I got to the hospital, and things happened a little bit differently than I had pictured. The nurse hooked me up to the monitor, and she got a panicked look on her face, and a doctor came in with an ultrasound machine. And he waved that sonogram wand over my belly again and again and again. And then he turned to me and he told me something that would change my life forever. I'm sorry, but there's no heartbeat. After hearing that news, all I could really think of was that I wish I had known. I wish I had known that my baby was in trouble. I wish I had known that she was dying. I wish I had known so that I could have gone to the hospital sooner. I wish that they could have done something to save her. There are so many things that I wish I would have done different. And my baby died, and there's nothing I can do to change that. But we can together help prevent other families from going through this. By teaching Kansas moms how and why to count the kicks, we can save lives. This is exactly why I want you to teach your patients how to count the kicks. Because Count the Kicks empowers moms to speak up when their baby's movements have changed. And studies have shown that this increases the chances of delivering a healthy baby, and that kick counting really can reduce the overall stillbirth rate. After hearing all of this, you might be wondering how we know that kick counting is even effective. Well, luckily this issue has been studied. It all started in Norway in 2005. A group of doctors set out to find out if kick counting was effective. And here's what they found. When they taught women how to monitor their baby's movements and taught them to formally perform a kick count once a day with certain guidelines, that the stillbirth rate fell. For that group of women who reported decreased fetal movement during the intervention time, their stillbirth rate fell by 50%. So that is really significant. And furthermore, the stillbirth rate for that overall study population fell by 1/3. So that's also a huge decrease. They found that there wasn't an increase in the rate of preterm births, fetal growth restrictions, transfers to neonatal care, or severe neonatal depression among women with decreased fetal movement during the intervention. The use of ultrasound in management did increase, but additional follow-up visits and admissions for inductions were actually reduced. So they concluded that improved management of decreased fetal movements and uniform information to women on kick counting is associated with fewer stillbirths. Another common question is, does kick counting really work for all moms? Big, small, and everyone in between. Well, the answer is yes. The same researchers that conducted that first large-scale study on kick counting went back and did a follow-up study to find out the answer to this question. And what they found was that mom's body mass index, gestational age during the 3rd trimester, and the placental site didn't explain the variation in the movement counting patterns. So they found that a perceived decrease in fetal movement shouldn't be attributed to a woman's basic pregnancy characteristics, like BMI or placental site, but it should be assessed as a marker of risk. Another question that I hear quite a bit is, if my patients learn about Count the Kicks, will they be more anxious about the health of their unborn baby? Well, the good news is that same group of researchers from Norway did a follow-up study that was completed in 2012 to get to the bottom of this question. And they showed that women who were taught to kick count were actually less concerned than those who were not taught to. And the frequency of maternal reports of concern, in other words, the frequency of women reporting to their doctors that they were concerned about babies' movements, was actually similar between the groups. And most women in the kick counting group considered the use of a kick counting chart to be positive. And so overwhelmingly, this was something that was shown to not cause extra anxiety during pregnancy for these women. You might also be wondering, how are the parameters for Count the Kicks determined? Well, in 2007, there was a bulletin put out, and it was called Guidelines for Perinatal Care. This was put out by the American Academy of Pediatrics and the American College of Obstetricians and Gynecologists. This citation is from page 114 under a paragraph called Assessment of Fetal Movement. And here's what they say. The perception of 10 distinct movements in a period of up to 2 hours is considered reassuring. After 10 movements have been perceived, the count can be discontinued for that day. Additional parameters were actually taken from the following study. You'll see a study citation on the screen. This is the same study that came out of Norway in 2009. And we actually followed all of their guidelines that they had given moms when they taught kick counts. Now, before we released Count the Kicks to the public, Dr. Neil Mansanger, who's a perinatologist with quite a bit of experience located in Iowa, reviewed all of our information for clarity and correctness. Now that we've learned about all the science behind Count the Kicks, I want to help you teach your patients how to count the kicks. So here's what you'll tell them. Count your baby's movements 1 time each day. Pick a time that your baby's usually the most active, and count your baby's kicks at this same time every day. It might be helpful to set an alarm for this time so that you remember to count. And a lot of women find that the best time to perform a kick count is after dinner or after lunch or after they've eaten something. You'll also want to tell your patients that they'll count swishes, rolls, jabs, and kicks as 1 movement each. Do not count hiccups in your fetal kick count. And you'll tell them, track your kick counts either on a chart, and there is an example of a kick chart in your yellow brochure, or you can use the free Count the Kicks phone app. The app is available for free on Google Play, at the Apple Store, or on www.counttthekicks.org. A question that your patient might ask is, how many movements should I expect during my kick count? And here's what you'll tell them. After a few weeks of counting, you'll probably see a bit of variance from day to day in the results, but for the most part, your numbers should be similar. This will continue to be the case for a healthy baby. Please call your doctor if you notice a significant change in your baby's movement pattern. The rule of thumb is that you should feel at least 10 movements within 2 hours. Your patient could also ask, what do I do if I notice that my baby isn't moving as much as she normally does? And you'll tell them, if you don't feel 10 movements during your usual 2-hour counting period, try to wake your baby up by drinking fluids, pushing on your tummy, or taking a quick walk. Then repeat the kick count. Call your provider immediately if you still don't feel any movements or if you're unhappy with the number you got in your kick count. You really just want to emphasize to your patient to not wait if they notice a change in baby's movements or if they have a concern that their baby's not moving enough. You want to tell them that you should call your provider if you notice a significant change in your baby's movement patterns. For example, if you normally count 10 movements within 30 minutes, and then for a few days in a row you notice that it's taking the full 2 hours to record 10 movements, this would be a time that you want to call your doctor right away. And remember that all babies have frequent sleep and wake cycles and will sleep often. But very rarely does a baby kick fewer than 10 times during a 2-hour period, since most babies don't sleep longer than an hour at a time near the end of pregnancy. And please remind your patient to count the kicks every day. If you'd like to order printed Count the Kicks materials for your patients, please visit www.counttthekicks.org and click the button that says Order Materials. There are several different packages offered here, and these are offered at cost right now. If you do live in Sedgwick County and practice in Sedgwick County, you can get free materials by contacting the Kansas Count the Kicks ambassador at kansas.ambassador@counttthekicks.org. If you're outside of Sedgwick County in Kansas, these materials are still available for purchase on the Count the Kicks website. We do anticipate being able to provide these materials for free to all Kansas providers within the next year. Free digital materials are available from Count the Kicks. The Count the Kicks app is available on our website and in the app stores. This is available for both iPhones and for Androids, and this is completely free. Free instructional videos are available for your patients at www.counttthekicks.org. You can also find these videos on YouTube at the channel name Count the Kicks. You can also print out a PDF kick chart that's available at www.counttthekicks.org. On the main page, scroll down about halfway, and on the right side, you'll see a button that says Free Count the Kicks Chart. This is available for unlimited distribution by providers. I'd also like to address a couple common concerns about Count the Kicks. The first common concern is doctors don't want to scare their patients. This is a positive public health awareness campaign that focuses on bonding with the baby, and it can include partners and older siblings. Count the Kicks has the added benefit of learning a baby's movement patterns so that a patient will notice changes in movement sooner. It does not focus on the negative or scary aspects of losing a baby. A second common concern is doctors are worried about increased calls. Doctors in Iowa, where the Count the Kicks campaign has been active since 2009, have not found that there has been an increase in calls. Rather, they have reported that patients are better informed about when to call, and when they do call, they're able to give more detailed and objective information. That in turn helps doctors make medical decisions. I'd also like to share a few tips on implementing Count the Kicks in your practice. At each glucose appointment, personally educate your patients on how and why to count the kicks. While patients are waiting during their glucose screening, you can show them the Count the Kicks how-to video on YouTube, or it can be found at www.countthekicks.org. You can also take the time to show patients how to access the Count the Kicks app. Again, that's at the Count the Kicks website. They can get that also off of iTunes or the Google Play Store. And overall, just emphasize the benefits of counting the kicks. Thank you so much for taking the time to learn about Count the Kicks today. This campaign has saved lives, and it can continue to save lives if it's shared with patients. If you have any questions about Count the Kicks, please visit our website at www.countthekicks.org, or you can contact me directly at kansas.ambassador@counttthekicks.org. Thank you.